Now that you know more about the levels of care, let's talk about paying privately for treatment and saving money where you can. The most important thing I can tell you, look for treatment even if you think you can't afford it. There is something for every budget. There are 5 things you should know about private pay. Sliding scale fees, pay overtime options, independent scholarships, in-house scholarships, and treatment seasonality. Many facilities will offer a sliding scale fee for those who pay privately. This is an income-based payment plan. They might also offer a pay overtime option. This typically requires a contract and a credit card on file or preset monthly payments. Be aware that some facilities will refer you to outside loan companies. Before going that route, we recommend exhausting all other options, as these types of loans can be financially risky. A better option would be an outside advocacy group that offers independent scholarships and support. If a facility has multiple openings for new patients, they might be more willing to offer scholarships or discounts. Here's an insider tip. There is a seasonality to the treatment industry. For example, it is often easier to get a scholarship in the fall when demand for treatment declines. You may be able to use this timing to your advantage, but it's important not to delay treatment for this reason alone. Remember, treatment facilities are competing with each other for your business. It is reasonable to ask questions about payment options and discounts. Also, keep in mind that payment for care may be tax deductible. Now that you know the ins and outs of paying privately, I encourage you to start making calls and find a provider.